Hi YouTube, it's Jen here. Thank you for stopping in and hearing this update. It has been a little bit more than 2 weeks since I've posted, but a lot has happened. The surgery has been completed. On April 27th was the surgery, but April 26th we drove to Charlottesville and stayed the night at the Graduate Hotel, and my husband and I got a chance just to decompress and just prepare for what was coming. The entire family was actually really relaxed, and we were just excited for this to be happening because we all feel that this is a major step in the right direction, a very positive step towards me getting an active life again. One of the great things that happened was that I was able to go and visit family who is she's elderly, and she has been diagnosed with cancer. So it was a chance for us to go and see her, and that was fantastic because she lives, about 3 hours away. So we saw her and then went to the hotel and just kind of chilled out and relaxed because we had to be at the hospital at 5:30 in the morning the next day. So on the 27th, we got up and went to the hospital expecting a horribly long wait and, a lot of tension and anxiety, and none of that happened. In fact, it was actually very relaxed. We got over there and everything was very streamlined at UVA. It was quick. It was like Chick-fil-A, but at a hospital. I mean, it was really fast, really, put together. Everybody was upbeat and cheerful. And when we got into the surgical room where they got me prepared, there was no stress, no anxiety this time. Now, in previous surgeries, I had developed what the surgeons had referred to as surgical PTSD, and that is from the sheer amount of surgeries that I've had on this leg. It's a growing anxiety that occurs, and literally anything that is surgically related can set it off. So for example, when trying to file the insurance and making sure that we were ready and prepared for this latest surgery, just seeing the address of the surgical building and seeing some of the words like surgery caused a massive anxiety attack, and it was really awful. But it's something that happens. A lot of people get this, and it's just basically your body remembering that trauma and reacting to it preemptively. So on the 27th, I had the surgery. Everything went incredibly well. We were able to have the TMR procedure done on the nerves. So there was another surgeon who was able to come in and do that, and he said that everything went great. So I spent 2 days at UVA. I mean, I was in my room by noon, and they had lunch waiting when I got back from the surgical area, and there was no pain. The nerve block was working just great. There was no issues. And then there was just, an amazing nursing staff that took really good care of me. Those guys are so awesome. And it was just very appreciated to have such a kind and caring staff, even though there was a lot of people there. And so they had a lot of patients to take care of. Apparently things were going so well that I was able to be discharged a day early. So that was pretty good. I came home on Thursday, the 29th, and my husband had my sewing studio set up. It's also the den of our house set up. And this is where I currently am. There's a futon that's laid out here. He put together a nice futon. You see my kitchen is in the back. We have a nice chalkboard wall that helps keep us all organized. And he got me a full-sized futon so that I can have my service dog here with me. And Murphy does. He stays with me all the time. He's very clingy. If there's any opportunity for my other dog to come visit, he does. He jumps up and will snuggle with me until Murphy pushes him out of the way. So the first week of recovery was actually really great. We expected, because there was a nerve block, so they put in a nerve block and it was just a bulb pump, and that contained anesthesia and just I think there was 2 separate medications that were in it, but it lasts 3 days, and it basically completely blocks all the nerves in the leg, and it causes there to be no pain. It's a wonderful thing. And in my opinion, frankly, so much better to have than the just huge litany of medications that they give you that include narcotics post-surgery, or post-surgery for surgical care, pain management, etc. I just think that if they extended it instead of 3 days, made it a little bit longer, or maybe do a second pump, that would just be so much better in terms of the opioid crisis. However, there's also a high risk of infection with any type of inserted object into your body, like the pump itself. So that was removed on Sunday of last week, and we were really expecting that as soon as it was to be removed, that it would be like instant pain. But in fact, it was nothing. It was amazing. There was no pain at all. So I might get like occasional little aches. I found that the little phantom feelings, like I could feel my toes moving, things like that, it was just comical. I was immediately touching my leg, and they had told us in the hospital that we needed to start, touching it, and, not to touch the sutures, but to touch the leg, desensitize it, really get used to it, look at it, etc. All of this helps when trying to get fit for the prosthetic, because you don't want your leg to be super hypersensitive. For me, it was really no big deal. I mean, I started touching it right away. I was massaging it because I was getting Charlie horse feelings in the back of the calf, because what they did is they cut the calf and then folded it over the bone, and so the calf muscle kind of slides into this tapered shape at the end of my stump. So I've been massaging it, I've been rubbing it. The bad thing is, however, I developed a rash almost immediately. Now, this is also something that has happened with the other surgeries, where I get, it's a bad itchy rash that almost turns into, or most of the time does turn into, hives. This time it hasn't gone to hives yet. Like, please, no. But it has been a really horrible itchy rash. And so we've been taking off the leg brace and just, again, massaging it, putting on calamine lotion, icing it a lot, keeping it elevated, taking Benadryl, etc., etc. So we're trying to manage that as much as possible. But I got to tell you, as bad as the pain can be, the itching, and that is just so much worse for me personally. Maybe it's because I've dealt with pain for the past decade to a level that most people couldn't tolerate. But honestly, the itching, I have no tolerance for it at all. It's like it drives me absolutely insane. I just can't take it. So the calamine lotion and the Benadryl has been my best friend. Now, during the first week, like I said, everything was great. And it was really better than expected. I started PT this last Tuesday, and I have an amazing therapist who is Scottish, so he has this really awesome accent. And we talk, and he's funny, and he's been really, really open and transparent about everything that is going to happen or should expect, or I should expect or could expect, things that have happened to other patients that I might experience, etc., etc. I've been doing a lot of the exercises already, so that includes leg lifts and anything from adduction, abduction, superior lifts, and then laying on the belly for inferior lifts or posterior lifts. And that has all been, relatively okay up until this past weekend. On Friday, the pain really kind of started, and that has been pretty much electrical pain, and it's a huge sharp jolt of electricity that goes through the stump, and it contracts all the muscles. And it started Friday, and then on Saturday I got to go outside, which was awesome. It was beautiful weather here in Fredericksburg. And my husband took me out onto the back porch, which was cleaned up, and I got to sit out there, even though it was a little bit chilly. He brought me a blanket, and I sat out there for 4.5 hours visiting with some friends, and it was just amazing, just getting to be out there and watching the dogs play. But I don't know if it was the combination of being outside or that it had already started hurting, or if it was just that little bit of activity, or if it was the cool weather. I don't know what the combination was, but Saturday night, I was in so much pain. I wasn't even a functional human anymore. I was screaming bloody murder. Nothing was helping with the pain. We were icing, massaging. It was just jerking very, very badly, to the point where I now have bruising on the lateral side of my leg and right at the tibial tuberosity. There's like dark bluish green bruising in that area, and that's where the muscles were pulling the hardest, to the point where I have strained ligaments on the side of my knee. So it has been a nice combination of muscle relaxers and pain pills for now. Right now, we have a bunch of calls into various doctors, including the surgeon, because the physical therapist is concerned, because usually he said this happens immediately after the pain pump wears off. So he finds it interesting that I happened to wait a full, week and a half before I started having this kind of pain. But at the same time, he also does say that it's normal. It's just that the timing is abnormal, and it's not good to have the bruising or the strained ligaments. So we're going to wait to see what they say. For the time being, I'm just keeping it completely encased in ice and elevated, and I'm easing off on PT a little bit, but I'm still moving. I'm still able to get around, use the bathroom. I've been able to let the dogs in and out, which has been a little bit scary because, there's balance issues. And, it's been a wild ride so far. However, my attitude has still remained incredibly positive, very upbeat. None of this has gotten me down. I am still so incredibly stoked because I know that this is just a small and very temporary thing. And it's one part of the process towards me getting back an active life. And let me tell you, once I get a leg, there is nothing that's going to stop me. Right now, my husband, Noel, has already been looking up diving legs for me, and it's fantastic. We've been talking about not just doing open water, but starting off doing a lot of simple diving in the rivers that are around here and in the DC area, although not the Potomac because we're not really into bull sharks. So we've been talking about where we can go that'll be shallow enough that the kids could also play in the river, but, we could get in some, good scuba diving time while we look for, basically picking up trash in the rivers, but also just seeing what little adventures we can find. And having some really good fun family days, because the past several years, I haven't been able to go out. I haven't been able to do anything. So we're already putting together a list of where we're going to go and what we're going to do, and it's really exciting. So that's been the update so far. I'm sorry I haven't been doing much, but a lot of this has just been, it's really exhausting, honestly. And part of it's vanity. I wasn't really sure I wanted to show off how I looked while healing. This is my freshly washed hair, and, I managed to put on a little bit of eyeliner, but that's about it. So part of it is vanity. I apologize. But really, it's just been an amazing time. I have just the best friends. There's been so much love and support, and I am just beyond honored for the people that are in my life. One friend sent me this awesome pillow. It says, "I am officially on my last leg," and they forgot to include a note in it when it first came, so that was really hysterical because we had no idea where it came from, and it was the best joke ever. We were laughing so hard. It was just great. And then my other two friends, who are very dear to me, on Mother's Day, in fact, gave me a teddy bear, which I can't reach right now, but it's from it is a Vermont teddy bear, but it's also part of the Amputation series. And so this teddy bear is missing its lower left leg. And my other friend who helped pay for the bear made the bear a little outfit that is an Ottoman outfit. And for those of you who do know me, I make historic Middle Eastern, Persian, and Ottoman clothing, but I also make other types of things. Like I've done weddings and cosplay and pretty much you name it, I've made it. And so that's kind of one of the things that I do to help bring in money for the family while I'm not doing work in my career path. So she made this bear a really amazing little Turkish outfit, and it is so cute. And it was just so touching and so amazing. And it's not only just kept the spirits up, but it really does show the quality of the people that are in my life. And I'm so blessed and so excited and so happy to have them a part of it. And really, it's everything. All of this has been a blessing. So I prefer to take a look at things that might seem negative to some people and try and see the positives in them. But truly, this really is a case where it's not difficult to find it. This is an awesome situation. I'm not sad about it. My kids have been having a great time with it. They've nicknamed the leg already. It is now Peggy. And my daughter keeps calling the leg just ridiculously cute. My son has likened it to a big toe. So they're having a good time. And so far, everything remains very positive and upbeat here. So that is the past 2 weeks. And again, I'm sorry I didn't chime in sooner or show you the hotel room or any of that other stuff. Wasn't much to look at. So that is the latest. And basically, I'm just here chilling with my pup. See, Murphy is now moved. He lays with me pretty much constantly. He has to touch me like all the time. So he's here with me, and he will probably stay with me for the next several hours. So that's it. Thank you so much for chiming in, and I will try and be better about making more posts and giving you updates, especially after this next week because I see the doctor, and so we'll try and get some video of that. All right. Thank you so much for chiming in, and have an awesome week. Bye.